right. Hello. Welcome to Release Point Therapy. I'm Dr. Henele. What we want to do is show a few of our hand techniques, and one of the most important in the system is what we call superficial fascial expansion. And it has a couple of unique features about it. So wanted to share those with you. So come on in a little bit closer and take a look. First thing that you want to see is that before we progress deeper into the body, it's very important that we prepare the muscles underneath to have a little more space. So what we do with this technique, we expand the fascia. And in doing so, sometimes, I don't know if you can see this on camera, but you can see we can actually keep a parasympathetic breath rate going, which is very important to everything that we do. So what we search for initially is a good hold, and let me tell you about the dynamics of a good hold. The dynamics of a good hold, number one, we have no space or very limited space between the forefinger and the thumb right here in the web, so that I have my entire palm contacting my client. Now this is important because it sends a lot of calming energy, especially through my hand, right into the client's body. And we can see that that's actually occurring because she's breathing. So I don't need to ask the question all the time, oh, how's the pressure? How does it feel? How does it feel? Because I don't know about you, but that's pretty annoying to me when I'm getting a body work session. If I just watch the breath, as you can see here, it's expanding still. The client tells me everything I need to know. So in superficial fascial expansion, what we're after is this. Number one, start out with a triangle. Give a little bit of width between the fingers. Lay the palms flat. Press in with your thumbs, pull back with your forefingers, and now you have the hold. Now how much should you lift? That's always determined by the client's breath. So I got a decent breath going here, so I'm going to lift just a little bit more, and boom, her breath opens up. So she just told me I'm at the exact perfect lift with the technique. Now what I can do is I can begin walking, which is one hand holds, in this case the left one, while the right one, you can see the thumb comes into the tissue and then draws the tissue back. Thumb comes in, draws the tissue back. And what's very important with this is once I get the tissue drawn back, watch the heels of my hand, they're going to drop down just a little bit. And what that does is it accentuates, watch my thumb, it accentuates the lifting effect on the technique. So it makes it very pleasant, almost like a caress as we're working through the tissue. As you can notice, the breath is still moving as we work. Now let's say that in the process of working through the tissue, I'm going through, everything feels pretty fluid, it's moving very nicely right now, but then I go, oh, I found a little spot where there's some hardness, maybe some crunchy, something of that effect. What I do next is I focus the hold in what's called acu-lifting, and this is a little bit more advanced application of the technique, but what it does is it lifts the soft tissue away from the muscle. It allows some blood to get in there so enzymes can help you break down the scar tissue. And if you do it over a meridian or a meridian point, you get the added benefit of the energetics of that point. So it starts working on multiple levels simultaneously. And once again, how do we know that the technique is being effective? Because we're basing everything on the client's breath. So in this case, look at the client. We're getting great breath responses. I don't have to coach her through her breath. So we know we're producing energetic as well as structural shifts. And in a nutshell, whether you're practicing superficial fascial expansion as a fascial hold, as a fascial walk, or even as an acu-lifting over a specific point, all of your efficacy of your treatment is witnessed in how your client's breathing. And that's what we do in a nutshell with this technique.